On this episode of Africa Health Check,
the devastating impact and negative effects of COVID-19 affected everybody in the globe.
The pandemic affected us in different ways. It reduced to an inflow of our clients.
We highlight some of the biggest conversations of the season.
A lot of effort in terms of capacity building have gone through the health system on the continent.
And focused what is to come. Pan-African greetings to you all from Nairobi, Kenya, where we are bringing you a bigger and better season 3 of Africa Health Check. I am your host, Hohontlejang Paladi Morokozo, and I'm inviting you to join us for yet another season of thought-provoking and impactful stories and conversations. On this first episode, we will be reflecting on season 1 and season 2 of Africa Health Check, as well as touching a bit on what to look forward to in season 3. One of the key things we will be focusing on for this season will be how to build more resilient communities, encouraging a community-driven approach to public health, strengthening public health systems, and highlighting some of the barriers we as a continent need to overcome, among other topics. As usual, I am not riding solo. I'm joined by my usual expert panelists, Dr. Marianne Morathi, the chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. Dr. Marianne, Reverend Achampong, welcome to the show.
Yay, thank you.
We're getting to meet for the first time. It's been 2 years of connecting virtually, having network issues, finally we're in Kenya for this. So it's really great to meet you in person.
Thank you very much. And I am your host now. Nairobi. So welcome to Nairobi.
Asante sana.
Hey, I love your Swahili.
Absolutely. So we want to just sort of reflect on season 1 and season 2 of Africa Health Check. And I'm going to start with you, Dr. Marianne. For anyone who didn't have an opportunity to watch season 1 of Africa Health Check, maybe you could just give them a summary, a highlight of what we're discussing, the key issues that came out in season 1.
Oh, season 1 was very interesting, particularly for me. We were in the midst of COVID-19. We were all discovering what's this new disease. And for me, what really stood out was it was a platform of just discussing the disease in a forum that now we're talking to different people, learning how they are coping with the disease, learning awareness. What is COVID-19? Where does the 19 come from? And also now what the virus is all about, me being a virologist, a microbiologist, and really teaching the public virology. You know, I've been used to a classroom with medics, talking very hardcore science. So now I myself in season 1 had to learn how to step down and now really break down the science. So season 1 for me, the entire episodes was really creating awareness of a disease that really literally brought the world to a standstill. And then from there now we're learning how to cope with the disease, how to prevent the disease, how to protect our loved ones, not just physically, but also emotionally, mentally, spiritually from the Reverend, and the beautiful stories we had around the continent. So that really was season 1.
Yes. And as a medical practitioner, I mean, we discussed a wide range of topics, but which topic in particular would you say closely resonated with you?
Oh, I think there's a topic we discussed on mental health, but what we're focusing on was the mental health of our young girls and women, particularly during that time of COVID-19. How are they coping? And at that point, we were seeing reports of a high rise of teenage pregnancies. So this is what literally our young girls in Kenya, there were headline news, what's happening during lockdown to our young girls because the pregnancies went up. So there's this particular group, I think it was from Malawi. I'm not very clear on that, but it was a group that was focusing on social media and mental health of our young adults, our young women, and they had a platform where they could log in, talk about what their challenges are. Is it sexual health challenges, mental health, or is it something physically they needed? So that really resonated with me because my background, my research, my work has been on HIV, sexually transmitted infections that affect our young girls and women. So that I felt, wow, we are taking it a notch higher by using technology, because at that point, our young ones, the teenagers, were all on social media. So why not use the platform they're using to advocate for better health? So that stood out for me.
Absolutely. No, I remember that very well. And I do remember that we featured a story about an organization that was using digital platforms to offer free counseling services, therapy, and so on and so forth. So really, really remarkable and powerful episode that we had there. And going to you, Reverend, I know you were very passionate about so many of the topics that we discussed during season 2. But if you're just to give a summary, a highlight of what was the theme, the common theme among all the topics we discussed during season 2?
I believe in season 2, we're trying to identify community groups and people that would commit to the fight of COVID-19, and the youth of Africa, the youth of our communities came up as a subject that we need to look up to, because we said that in about 2050, the world's population will be about a quarter of Africans. I mean, about a quarter of the world's population will be Africans, and we're talking about the youth. The youth is the future of our continent. So we looked at how the youth had involved themselves in the pandemic, the support they raised, the sacrifices they made, and the challenges that they faced with their education, with support, with all kind of things. So to me, that was the talking point that got my attention, and as a religious leader, to ask myself, what can we do for our youth today? Because we have to look ahead, you know. And it was quite interesting that some of the youth had come up with innovative ideas, inventing things, embracing the whole challenges, going their ways to help the fight. So I think that it is struggle. We were talking about in the season 2. We were also talking about people that have been left out of these things. You know, the far to reach people and places, and then we saw that we need to identify those groups and see how best we can harness all of them and prepare them for the future.
Yes, absolutely. A lot of the things that we talked about in season 2 were also about vaccine rollout. We were partnering with the Africa CDC. So I remember we had a couple of feature stories and a panelist who were just sharing their experiences around vaccine availability and the rollout in the countries. What would you say was one of the things that was just really outstanding from all of those episodes where we're talking about the rollout of COVID vaccines in Africa?
Yes. COVID-19 exposed Africa in many ways. It showed that we were not ready when Pfizer, BioNTech, AstraZeneca discovered these vaccines and they started producing them. Africa was on the receiving end, and the timing was poor. So that the questions was what is Africa doing for herself? You know, what can we do for ourselves? Do we have the capacity, academic capacity, the financial, even the political will to embrace the challenge and fight? Because whether we like it or not, another pandemic might come. And how soon will we be prepared for it? We thank God for CDC Africa and the collaborative efforts of MasterCard Foundation all who threw in their support to vaccinate our people. But at the end of the day, what are we doing in times of peace whilst we wait for probably the big one? So it became a subject worthy of looking at again, you know, even in this season. So we keep it in front of our people, our policy makers, our political leaders, all that Africa must rise up to these challenges. And we're going to talk about emerging diseases and those kind of things. So the time is ripe, I believe, that we harness our potentials, our strengths in this area and prepare for the future.
Absolutely wonderful. So, Dr. Marianne, we have been doing Africa Health Tech for the last 2 years, and I want you to just share from a personal level what has changed in your life ever since being part of this program. What have you learned? I'm sure you know so much about medicine as a medical practitioner, but what are new things that you learned or innovative things that you heard during the show, or how has just being part of this program and the conversations we've had sort of like renewed or restored your faith in humanity, or brought in any new inspiration or motivation for you at an individual level?
Wow. So for me, it's been a life-changing 2 years, particularly brought by this program. And what really stands out for me is what I learned from the African people, that's resilience. You know, we expected in the show to see in the different interviews, people downcasted, people really adversely affected. Yes, there were people who were adversely affected, but within these people, there was a spirit that rose of, okay, you've given me lemons, let me make lemonade. And that's, I mean, one of the examples here is the social media. I didn't know we can actually use the social media to reach people using the tools, particularly the teenagers, the young people. We can reach to them where they are. We don't have to call them in and sell what we're trying to tell them about maybe changing their lives. You can actually go to them using the different platforms. Then another really good example was a community or some group organizations that used what we call WASH, water, hygiene and sanitation, and they came up with ways of collecting. We were using a lot of masks, so, and these masks were contributing to, can I say, the waste products, but we're able to innovatively come up with ways to collect these masks, dispose them safely. And again, I think that community or that organization won some award, some Royal Engineering Award for coming up with some very innovative ways to clean up the environment using engineering, and this gained a worldwide platform. So for me, resilience. What did we do with our situation and how did we rise from that? From a medical perspective, I dealt with nurses, doctors, scientists who were literally burning the midnight oil, either overwhelmed clinics, overwhelmed hospital wards. For us, for me, I'm usually mainly in the lab, samples coming in and out. I was quite afraid of going home and bringing the COVID the COVID virus from the lab to my home. And I remember I would start undressing from the gate, just so that I don't bring anything home. But from this experience and also interacting with different people, that fear came out. I was able to, learn how to wash hands, learn how to do many things and protect my loved ones. And again, that message was really solidified by the different interactions we had together from the different people that we spoke to in the program. So really that resilience, that networking was life-changing for me.
Yeah, absolutely. I think you're absolutely telling the truth there, saying that, we saw a rise in, heroes in our community.
Yes, that's the word, heroes. Yes,
doing extraordinary things. And this is why in season 3, one of the things we're going to be doing after each episode is that we're going to be shining a spotlight on a champion of health in all African countries. So each episode we're going to have one champion that we're going to be shining a spotlight on, celebrating them, embracing them, and sort of also to inspire all of us to say you don't have to wear a cape to be a hero. It's just a matter of what you are doing in your community. You see a problem and you decide, I'm going to do something about it, no matter how trivial that effort may seem. So absolutely, really, really, really remarkable. Maybe to go to you, Reverend. 2 years, Africa Health Check. How has that impacted you as an individual at a personal level?
It's the revelation that a section of our people have been for so long been neglected. Mental health victims. The revelation that as Africans we try to make mental health more of a spiritual issue. But when you really study the subject, and the science has informed us that there are many other sources for mental health. And being a religious leader and a pharmacist, I feel very, very, very disappointed with myself, with my colleagues, that we have taken that approach. I was mentioning earlier to Dr. Miriam that in Ghana, this vast country with great potential, only 3 hospitals for mental health institutions, and they are all in the south. And to dismiss a mental health patient as a spirit-based is the demonic thing, and neglect them comes with stigma and all those things. The question I've been asking myself is, what do I do as a person, as a minister, as a pharmacist, with my church, with my colleagues? And to me, to revisit this topic again in this season is something that I look up to, because there must be solutions to help our people that are down.
Absolutely, and it's still a pressing issue in Africa. As you're saying, there's still a lot of stigma that is attached to accessing mental health services, to a point where even where the services are available, people are afraid of accessing them because of the stigma that they have to face in our community. So that is also a topic we're going to sort of dive into season 3. So you've transitioned to basically what was going to be my next question. What can viewers expect to hear during this season 3 of Africa Health Check, Dr. Lilian?
You know, that's a good question, because I also get asked quite a lot as a microbiologist. What's next? Is there something else coming? Is there a virus coming? And we have this big topic in the university which we call emerging and re-emerging infections. So I'm hoping that we'll be able to tackle that, and we'll be able to discuss what we have learned from COVID-19 so that we can be able to tackle any other emerging or re-emerging infections. And believe me, these infections are coming, new ones are coming. WHO calls it pandemic X, because we don't know when it will come and what name it will be. But for me, I'm not really worried about that pandemic. I'm worried about what structures do we have in place to prevent the world from shutting down that we saw in 2020, 2021. And are we ready as a people? Are we mentally ready? Are we physically ready? Are you exercising? Are you looking after yourself so that any other infection comes, meets you ready? I think it's what we see in the Bible. Our Lord Jesus Christ, for the Christians, He will come anytime, any place. Are we ready for Him? So for me as a virologist, what are we doing to be ready, prepared, and at peace to make sure that when the next infection comes, we are ready to tackle it?
Absolutely. Reverend, what do you think the viewers can look forward to?
What viewers can look forward to in this season is continuation of what Africa Health Check has started to do. And what is that? To make us aware that our first wealth is health. And that a healthy nation or a healthy continent is a wealthy continent.
Absolutely.
So then Africa Health Check actually is a mouthpiece of CDC Africa, trying to let our people know that health issues are very, very important. Yes, Africa Health Check came in the middle of a pandemic, COVID-19. But gone are the days or the years or the times where society relied only on social distancing, separation, non-pharmaceutical interventions to handle pandemics, to handle infectious diseases. Science has informed us that through vaccines, and we have an eminent scholar here to justify the point that vaccines work. And thankfully, what the vaccinations that people took probably, I would believe that, helped to contain the pandemic. So then, this season, we are going to, in my mind, we are going to continue the conversation. What is Africa doing with regard to finding solutions, building structures, identifying people that can help the fight in case any big one comes. So we are ready to hit the road and nip it in the bud if possible. So I look forward to these discussions, but I hope that this program would continue, because health issues are not only vaccines, are not only infections.
COVID-19.
It's a whole wide range of issues. There are non-communicable diseases, and cancers, cardiovascular issues, chronic obstructive pulmonary diseases, cancers, on all these things are taking people. So Africa Health Check is coming as an advocacy, as a mapping to make us aware of what is going on around us, so we can all rise up and fight for our destiny.
Absolutely. And I'm happy that you mentioned the issue of sort of like broadening the scope, going beyond focusing on the pandemic or COVID-19 to now broadly talking about public health, because, Africa still faces a lot of challenges in terms of the burden of disease, in terms of realizing the universal health coverage targets, in terms of access to all that, access to health that is equitable for all. So we're going to be now broadly touching on other public health matters, and also looking at lessons learned from COVID-19, and then going forward, what needs to be the priority, what we need to focus on. So I want us to dive a little bit more into that after the break. Don't go away. We are going for a quick break where we will highlight some of our favorite word on the street moments from the last seasons. Let's have a listen.
Most of our healthcare workers are moving to abroad to go and work. So when you train them and they go abroad, they go and work for other people.
There is no way you're going to train, a nurse or a doctor or people, public health, people, and then you fail to train people. You have to train both. Otherwise, you're going to implement things that won't work.
C'est important que moi je pratique, c'est de pouvoir renforcer mon système immunitaire à base des aliments que nous mangeons ici chez nous. Si vous renforcez votre système immunitaire, ça vous permet de résister à cette virus et à beaucoup d'autres maladies qui peuvent survenir dans cette période de cette pandémie.
Regarding the vaccine in the youth, I can encourage them to go and vaccinate. They must not listen to the social media and news. They must go and vaccinate. It is very important for their lives.
And that is some of the favorite word on the street moments that we had from season 1 and season 2 of Africa Health Check. We are continuing to unpack season 3 of Africa Health Check and sort of highlighting what you as a viewer should expect, as we'd love for you to be part of this season 3 of Africa Health Check. Just before the break, we were talking about the topics that viewers can expect. Now I want us to flip it a little bit and talk about what we expect viewers to do after listening to all the topics, the testimonials, the feature stories, so much inspiration. What do we expect an ordinary citizen or somebody at home anywhere in Africa listening to all of this information and absorbing it? What should they do after that?
Well, that's again a great question and a good point to discuss, because we expect our viewers to do so many things. One of them is to be aware.
Yeah.
Be aware that there's a lot of misconception that, first of all, maybe COVID didn't exist. What was that? What did that hit us? No, reality check is it hit us. But then again, I want people to be aware that there are other infections that are at play. Some infections never went away. In fact, we were discussing with Reverend other issues that are really affecting us. There was flooding in Malawi the other day, and what followed after flooding were high cases of cholera because, you know, the flooding, the sewers, all those things, again, affected our populations in Malawi. We see a lot of cholera as well in Nairobi once in a while after flooding or when we are not very careful with our hygiene practices. So I want people to be aware of, you know, there are other infections. Are you taking precautions? Are you eating healthy? Are you exercising? Are you taking time out? You know, mental health is a big topic, as Reverend mentioned. And also I would expect, apart from that, that everyone to go out there believing they're heroes. You can make a difference in anything and everything you're doing. If you work in construction, if you work in a hospital setting, as a reverend, and you have a flock that is following you, you can be a hero in your own community. So identify maybe the different gaps, people in need, as Reverend has already pointed out early, that there are people that are really neglected. Who are these people? And what are we doing about it? And again, season 1, season 2, we really highlighted some of these issues. I remember there was a story from Botswana where one of our heroes there identified a need of food. There are people lacking food in different remote areas in Botswana. What did he do? I think he had a trucking company and he used his trucks to distribute these foods. That's a hero. And he used what he had at that time to address a problem that was arising in Botswana. So I'd expect our communities to see many more heroes winning awards out there, making a difference. And, you know, as we have said, a healthy nation is a wealthy nation.
Absolutely.
We'll want a wealthy Africa.
A wealthy Africa. So people to take action, not just, you know, be inspired and nothing happens, but we're hoping that these stories actually galvanize you into doing something, starting where you are, starting small, but definitely doing something. Reverend, what do you think viewers should do after watching our episodes?
I think knowledge is power. Knowledge is transforming. You know, I will talk about wellness and fitness and the value of exercises. I mean, what is the point of listening to these points, researched information to better your health and do nothing with it? So we expect our viewers to put into practice what we are sharing on this platform. It might mean different things to different people, because if I'm in government, it tells me what to do to issue policies to support ideas that will fight for the health of our people. Now, if you are in a church like myself, and we've seen in COVID-19 how churches came together and supported So for our viewers, what I would say is that just don't sit aloof. Get involved. Community involvement is one powerful way by which most of these Ebola and other communicable diseases are being fought. So I expect this platform this season to awaken many. If you are a young man, if you're a scientist, when you've heard that your fellow African is in his own effort or invented something or is doing something, it tells you that, oh, if somebody has been able to do this in Africa, I can also do it. It's also showing empty places, needed areas, neglected areas. It is bringing spotlight on those places for action, you know, from whoever are responsible to do. So I expect a lot. Engagement is the word. Let us engage. Let our viewers engage this platform and all the things that we are sharing. Go back, research, find out whether the things we are talking about are true. These are scientific research, empirical data, all available. Let them go and come along with us, and it will make Africa a better place.
Absolutely. And it's about, after hearing all of this, it's incumbent upon you as an individual. What do you use all that useful information for? And I know there's a common saying that, once you get information, the best thing you can do is share it with the next person. That's actually one of the most simple or basic things that you can do, is to pass on the knowledge, pass on that education. And as you said, it's power. So go on and empower others with that information. There's a common adage that anything brilliant that was achieved started off as a dream, as a vision. So as public health experts and passionate enthusiasts about public health, what is your dream, your vision in terms of public health outcomes for Africa? In the ideal world, where would you like to see Africa in terms of our public health outcomes and indicators?
Well, okay, that's a whole topic in the university, strengthening health systems. So for me, really, first of all, I try to imagine of that mom in a village, and I want that mom to be healthy. I want that mom to be able to go to the dispensary down the road that is close to her. She doesn't have to, in the deep villages, they use donkeys and a cart as ambulances, and the ambulance is 6-7 hours away. So I'd want some equity in that she can walk to her dispensary. And whilst she's there, she doesn't have to be, first of all, long queues. She's quickly, her problem is solved as quickly as possible. We have a nurse, a doctor, the entire infrastructure right at that level, village level, available for her. Medicine is close by. If she's taking her child for vaccinations, that child, my dream for that child to have all the vaccines given at the right timings. They are readily available because again, a mother that's thriving, we want to also have a baby that is thriving. So for me, in a very simple, broken down nutshell, there are many structures that should be in place to have that happen right at the village. That for me is one very big dream, to have everything at the tip of her finger. In a bigger platform, for me, I would want to see our surveillance system at notch higher, in that we're able to detect diseases very early, right at the point of entry, at the borders, maybe at the forest, let's say things such as Ebola that start off with, very close contact with animals. So having a very good detection system, surveillance system. But then it doesn't matter if it's a very good system, but that system needs then to communicate to the authorities in place. Is that the Ministry of Health? Is it the other government officials? So that we can nip that bud as it's happening at that point. We don't want it to cascade and cascade, then we'll be wondering, when did the rain start beating us, with like COVID-19. So having very good surveillance system all around, and people are aware that, okay, there's a fever that I've noticed in this village, maybe the village where that lady is coming from. What do we do about that fever? Do we have, in that dispensary, is there a lab that can detect and do a diagnosis very quickly to say that's not malaria, it's not a diarrhea or any other infection, this is something new we've not seen. How will that lab or that dispensary report cascade that report to the main relevant authorities, all the way to the CDC, to WHO, so that we can concentrate in that village and see what's going on before it spreads. So that's, I know that's many topics in between in there, but in simply, that's my dream for Africa and for our people.
Absolutely. It shows you're passionate. That's why.
I mean, that's what my passion is.
But basically, strengthening our preventative mechanisms and also leaving no one behind.
That's right.
Reverend, what is your vision for public health?
My vision for public health is simply this. It goes quite a lot. There is no public health without public health workers, practitioners. So my dream is that people, authorities, those stakeholders will begin to look at the way we train medical personnel, in Africa, because there is no healthcare, once again, without healthcare practitioners.
Absolutely.
So We train more doctors, more nurses, and those in the health area. Many people are in villages, in rural areas, not how to reach places, partly also because our health personnel are very few, and they all concentrate in the cities.
Yeah. So
if our government leaders are listening to this, look at COVID and train people, build facilities, because what COVID showed us is that they make, how do you call it, makeshift camps to attend to people here and there. I think we should wiser and then look ahead and say that if we're going to take good care of our health as Africa, then let us invest in personnel and institutions that will make it happen.
Absolutely, absolutely powerful. My vision is very simple, is that access to public health should not be a privilege reserved for a few, but a right enjoyed by every single person. But that brings us to the end of our episode. We'll definitely have more opportunities to discuss this further, as I can see you want to still say more. But reserve that energy for the other coming episodes before, yes, we're warming up, which is absolutely fantastic. But before we wrap up the show today, I would like for us to take a look at our African health champion for this episode.
In Tanzania, the future of healthcare is unfolding with a revolutionary digital tool called Afya Data. Created by the Southern Africa Center for Infectious Disease Surveillance, this app transforms ordinary people and health workers into disease detectives. By harnessing the power of smartphones, Afya Data enables swift reporting of unusual health occurrences, leading to early disease detection and prevention. This open-source tool operates at both the community and national level, ensuring seamless information flow for better disease management. Afya Data is not just an app, it's an African health champion, leading the charge towards a safer and healthier continent.
Absolutely inspiring, and that brings us to the end of today's episode. From my awesome Africa Health Check team and we give you a big thank you for tuning in. Remember to like, subscribe, and leave a comment on all our digital platforms, because we would love you to be part of the stories we highlight here. Until we meet again, same time, same place, remember, the future is Africa, the future is today.